And final question for all of us here. How can healthcare providers, particularly allergists or those who treat allergies, be better allies in helping address the disparities in allergy care?
I feel like policy is a big one. It differs so much on like a local, state, and federal level. And I think a lot of times we think straight to federal, but there's so much policy on a local level that probably impacts allergy care. We talked about school-based. Yeah, I keep talking about schools being a pediatrician, but we talk about school policy even, and, you know, whether I think it's a requirement that schools have, you know, some of these things in place, but just making sure that they're being implemented. And then making sure that we're working with you know, these institutions and not working against is another thing. And then that way, you know, if there is an issue that's worth addressing, it doesn't feel like we're conflicting. It feels like we're working to a common goal. Because I think sometimes it's easy to play like the blame game if something happens. But if we're all like, we just want what's best for the kids and the patients, then the outcome is better and easier.
We have a few local allergy groups that are statewide and even more local among the hospital system that we're in. And I think it's just having a support program and just open conversation and getting out in the community and teaching, as I mentioned earlier, with the schools more and more. I think all those would be important aspects of how to maybe attack or address the question you're having or the point you're trying to make.
Yeah, I'm a strong believer of public health initiatives also, considering that I come also a little bit from a master's in public health background. So I think it's really important that, you know, education campaigns like maybe government funded or nonprofit funded ones are in place to kind of educate the public about allergies, signs of anaphylaxis, and the exact proper use of epinephrine. Like it has to almost become like a CPR course for most people, I feel. And apart from that, I think some school policies which create a allergy-safe environment, I think is really important when it comes to that aspect of public health initiatives. So, and also research and development, I feel, because sometimes I don't think allergy research is receiving as much funding as I believe is important. So I think public policy that is a little more empowering towards allergy research would be amazing to contribute to the cause, to kind of, bring more health equity.
One small disconnect is when the people go to the urgent care ER, they sometimes will get an EpiPen, but they don't always refer to an allergy or at least follow-up, either primary care or allergist. And to this day, even though we go when we tell the residents and the staff, it's probably even 50% that I think are not referred formally. I think there's a real gap there. I think it's really key.
Absolutely. And I feel like that's where quality improvement comes in, and actually the power of research, like being able to chart review, see who has had follow-up, and probably a cool project for like a lot of centers actually to go back and do that and just help with the follow-up and the follow-through around that.
Yeah, sometimes the collaborative effort of patients and healthcare providers is key over there.
So clearly food allergy and even regular allergies in general are a big problem. Many drugs are in development or have been recently released, but not all patients are getting the diagnosis, the treatment, or the care that they need for many reasons. Whether there's policy, underfunded research, access to care, or just having the insurance or coverage, or being close to an allergist to begin with. There's a lot that needs to be done, and it's great to be on a multidisciplinary panel to talk about the needs that are out there. I think the four of us are doing quite a bit more than I would expect the average physician to do, and we're doing quite a bit for our community and getting ourselves out there to help these patients get better. There are so many next steps that are out there. I personally don't have any input in the policy, but more needs to happen. Education is always a great place to start and the foundation for change. And apart from that, there's much needs to be done, and hopefully this exposure for the public will help open some eyes and enlighten people who otherwise don't know.